Expanding your practice market share by 160 million in 18 months with MLGP. I guarantee my team will grow your patient acquisition and management, ensuring you gain a larger share of the market. And the reason why we feel so confident that we can achieve this is based on the past work we've done. Increasing 7 location laser body MDs customer acquisition by 8%. What's that mean money wise? Well, that means we generated an extra $11,000 a month in revenue in under 70 days. Or here's the big one here: Dental Corp's 520 location dental conglomerate patient experience strategy. This led to a forecasted 160 million in additional revenue in 18 months. Overall, we'll streamline your marketing strategies by working within your operational capacities. All of this will be managed by one integrated expert team. Sound good? So here's the 80/20 of this video. Using our MLGP methodology, proven from 7 location all the way to 520 locations, we will manage and enhance your patient growth and management. Meaning we cover Facebook ads, Google ads, website, SMS and email, call answer rates, and SEO. And if you don't see a substantial growth in bookings and an increased show up rate within 1 quarter, you pay nothing. We'll also give you tips we created from a 520 location dental portfolio case study in this call. Now, here's a couple questions that I'd like to ask you, which will help you whether or not know that this is a partnership that makes sense for you. So, is this you? Are you a multi-practice location business struggling to grow your patient base in today's competitive market? Do you feel overwhelmed by the complexities of digital marketing and digital patient management, when all you want to do really is just directly focus on providing a quality service and help people with your incredible skill set and decades of medical learnings? Have you tried hiring digital marketers to help you solve the patient acquiring and patient returning processes, but felt that they failed to ease your mind, instead just really overcomplicated things for you instead, making the entire process not even worth your time? So, seeing that you've answered yes to these questions shows a deep understanding of your needs. It's a great step to acknowledge these challenges, and everyone goes through them, so it's completely okay to have these. Over the next few minutes, I'd like to share with you how we can support you in these areas, offering guidance and tailored solutions that resonate with where you are as of right now. And best part, we get to see how a $1 billion portfolio went through these exact steps. So, why is this problem happening? Why do many healthcare practices face challenges in patient acquiring and patient returning processes? Aside from the ones who simply deliver a poor service, which I really hope isn't you, most experience this due to fragmented digital marketing efforts and inefficient patient management systems. And this typically leads to substantial losses from underperforming marketing campaigns because you're not looking at the numbers, 2, non-returning clients because you fail to communicate with them or you just don't have the systems built to communicate with them, and 3, an entirely undetermined amount of operational drag due to a lack of process and precise numbers. To make it even harder, the rapidly evolving digital landscape often leaves practices behind, unable to effectively utilize the power of digital tools and platforms for growth. Gone are the days of hiring one individual as your marketing person. That doesn't happen anymore. Following the old ways lead to missed opportunities, underutilized patient data, strained operational processes. So, what's the solution? Well, that's a great way to introduce myself. My name is Chris Vondi. I'm a growth and digital marketer who's worked with hundreds of locations and have consulted over 112 plus businesses in my 6th year in this industry. I've worked with billion-dollar national level dental conglomerates, which we've talked about already, and just like the cosmetic clinic following it, I've also worked with insurance companies everyone knows the names of, and furniture icons like Pier 1 and Linens and Things, and many more. So, the reason why we're all still watching is the meat and potatoes. How did we actually craft a strategy that led to a forecast of $160 million in extra revenue in 18 months? So, now I'm going to tell you how. I want to explain a few lessons that you can take from this plan. And I just want to note that these are ranges. These numbers are not the exact performance numbers within the portfolio, but it gives us a good idea of what these potentials could be and then what it could be in the end. So the strategy was planned around the main metrics of appointment attendance rate, appointment retention rate, and call answer rate. So to dive into each of these. So what is AAR? It is how often people showed up to their originally booked appointment. And the ranges for AAR are between 68 to 82% based on the portfolio. So if you see there, immediately 18 to 32% of all marketing budget just goes out the door when someone no shows or cancels. And then what's this data here? On the right hand side is the main thing we have to focus on with the black tiles. So that shows us the annualized revenue delta to benchmark. So this is basically what they missed out on. And from there, you can see it's quite a few numbers, going up to about 151 million for an entire portfolio. So appointment retention rate, this is ARR. So how often people showed up to the rescheduled appointment. So originally we had people who didn't show up to the original appointment, and now this is like our second chance in terms of who's coming back and how many people are actually returning to that second appointment. But technically it's their first appointment, if you get what I'm saying. So ranges for ARR are between 30 to 58%. So it's a bit less and a bit more than a 50-50 chance that when someone rebooks, they will show up. And then you see here on the annualized revenue delta benchmark, you see that there is quite a few numbers up there as well, leading to about 50 million. I apologize, 30 million of potential optimization. And then we go to call answer rate. So the rate in which a call is answered at a practice level, which I hope this is tracked by a majority of people, probably using something like CallRail. So the average call answer rate is about 65 to 75%. So when hearing those numbers, you go back and think 25 to 35% of potential calls that aren't even answered, which phone is typically the leading source of leads for the majority of these practices. So right there, you're just throwing out potential leads just because we don't have the processes organized in order to make this happen. So with these three metrics alone, we look back at the customer journey and begin changing the processes in which these metrics encounter pushback. So here are the potential pushbacks. We have 4 of them here. So learning from the Dental Corp example above, here's number 1, which is expanding channels of acquisition. So expanding channels of acquisition, this allows us to have multiple sources of lead getting opportunities. And what we do with these is we balance them out that work the best for us. This is an ongoing process. This is not a one-all scenario. It has to be something that's consistently ongoing because things constantly change. So when you look at Google Ads, you look at intent. So because people are searching for it on Google, Google Ads is typically the most expensive, but it is something you can reliably trust in terms of getting patients if you have the right campaign set up. So you have Google Ads, you have organic content, which is SEO and social media. So SEO is focused on ranking on Google itself. And then social media, of course, is just posting content and getting followers and making sure people see you on their feeds. And then you have meta ads. So that's Facebook and Instagram. So they follow something similar to Google Ads, except meta ads is more of a auction-based system, exactly like TikTok ads. So when you are able to balance these, you can have an accurate and predictable source of acquisition. So number 2, automate and or have salespeople pick up incoming phone calls in order to book maximum appointments via phone calls. So this one's a big one for us. So typically in a dental practice or an optometry practice or whatever specialist you want to look at, most people are being pushed through the admin. So the front desk, the secretary, whoever is at the front desk is typically the one answering the phone calls. So when we look at the previous data, we get to see that about 25 to 30% of all calls aren't even answered. So what if there's a way to solve that? So the way to solve that would be to either automate it in an AI generated filtering way, like, hi, you've reached, insert clinic name here. If press 1 if you are a new patient, they press 1. Or you can have a salesperson pick up the phone instead in order to ensure, which right here, this can be a 2-step solution, but the goal is to increase the answer rate to 90%. So as long as you get that 90%, it doesn't matter which solution is best for your business as long as you are getting those numbers up. So number 3, optimize email and SMS messaging to bring back previously acquired patients, in order to lower constant cost of acquisition and increase lifetime value. So this is another big one. This is all about retention and bringing people back that have already come into the practice. So when you optimize email and SMS messaging, the goal is to bring people back that have already come. So when they've come previously, you've already spent the money to acquire them. So the more they come back, the more your lifetime value increases, meaning you get more money for what you've originally put in. So when you're able to do this at a high level, you're able to put more money back predictably into the cost of acquisition in order to gain more of a market share. And we'll explain that in just a bit. And lastly, all of this must be tied together through accurate analytics. In the MLGP program, we provide the solution via our full-scale customer journey tracking. So I hope you get some actionable steps here, and I hope that you can continue listening along as we go through a little more in detail. So the MLGP breakdown. What is MLGP? It's Multi-Location Growth Partner. So we're a program dedicated to building and systemizing your patient strategies, foundations built on analytics and calculated formulas to determine profitability and efficiency within your business. We work hand in hand with your team, partnering, in order to grow as efficiently as possible. So grow your patient base and increase business revenue. So how is the solution different? Which is a great question. So not to be biased, but our MLGP program is a solution to all of those problems and more. So we integrate your digital marketing efforts across all potential channels, like the ones we talked about earlier, ensuring that your marketing budget is maximized and tracked efficiently. We also streamline your patient nurturing processes, making your operations more efficient and enhancing the patient experience itself. And this all results in people coming back in order to increase lifetime value, which overall allows for the business to gain market share, like I've said previously, when applying a percentage of that revenue back into acquiring more patients. And here's a really important chart. This is hypothetical. These numbers are not real, but I want to ensure that the theory is presented correctly. So, increasing lifetime value, allowing for a higher cost of acquisition, reduced variability. So what does that mean? We're going to look on the left-hand side, and we're going to see increasing lifetime value, allowing for a higher CAC, our cost of acquisition. So on the left-hand side, you have a lifetime value of $400 on a patient, and the cost of acquisition is about $200. So after all is said and done, once you minus the cost of acquisition, you're looking at $200 left over plus whatever expenses you have to minus after that. So if you were to keep them for $600, so if they increase by 50% from $400 to $600, then the cost of acquisition still remain the same. You'd be able to implement that much more budget back into acquiring more customers in order to grow market share. And if you look at the right-hand side, you see what happens when CAC increases without corresponding increase in lifetime value, meaning what happens when the costs increase and you're actually not driving more revenue. Well, you get to see it's a downward slope. And this is what we do within our program. So what sets our performance apart? Our unconventional marketing strategies. Our MLGP model is built on a foundation of continuous improvement, leveraging data to tailor strategies that align with your goals. We focus on reducing acquisition costs, as we talked about, maximizing retention, and enhancing patient experiences, setting us apart from typical marketing solutions. We understand the unique needs of dental, optometry, dermatology, and cosmetic clinics. Our strategy is data-driven and patient-centric, focusing on building lasting relationships with patients through personalized engagement, so people keep coming back. This approach not only attracts more patients, but also retains them, fostering loyalty and trust. So I just want to explain this written version of what I just said, because it helps just click things together. So if lifetime value increases, the ability to acquire more patients increases as well. Being able to acquire more patients equals predictable revenue and market share increase. If customer acquisition increases, profits decrease. If profits decrease, then that equals the ability to acquire and gain market share goes down. And that's what we're trying to avoid. we want to make sure we're making more money together. We've showed how our innovative strategies, Avodated Digital, have transformed over 112 businesses and over 374 locations. As you can see, just Dental Corp alone was 520, but enhancing patient attendance, retention, and optimizing call response systems. So the proof is in the meat and potatoes, or as most say, in the pudding. Mathematically calculated optimizations in a revolutionized patient experience is exactly what it is we promote. Our service is more than just a marketing solution. It's a partnership for growth. We're committed to helping your practice thrive in every aspect, from patient acquisition to operational efficiency and patient satisfaction. Just like Dental Corp and LaserBody MD and many more. Partner with us and watch your healthcare practice flourish. So, All this talk about pudding and potatoes is making me hungry. So if you want to click below to book a call, I'll see you there. Thank you.